this Board of Health monthly meeting for Monday, May 13th, 4:30 p.m. to order. Can we call the roll, please?
Danielle Chenoweth.
Present.
Samantha Carter.
Here.
Kyle Patterson.
Approval of the agenda. I'll take a motion for that.
So move, Carter.
Second. All those in favor say aye.
Aye.
Those opposed? That carries. Next, we'll have approval of the minutes of previous meetings. We have April 8th, 2024 minutes. I take a motion.
So move, Carter.
Second. All those in favor say aye.
Aye.
Next, we have public participation. Is there anyone here from the public who would like to speak to the Board of Health this afternoon? No? Okay. Correspondence from our public administrator.
I don't have anything to.
Yeah, go ahead.
Hi. I've received 2 emails from Ms. Jennifer Knott and Mr. Jim Barrett asking if we can move the public participation part of our meeting maybe later in the meeting.
Oh,
Or maybe even have a later start time so that the staff can make it to our meeting.
yeah, so a couple of things. One, we can absolutely put another public participation in today's meeting at the end. So if we want to go ahead and add public participation, we can. And I absolutely support us looking at a later start time so that working people can access. I believe we would need to we need to put it on the next meeting agenda to move meetings.
Okay.
So if we could go ahead and do that. And I just want to note that on the second Tuesday of the month, I always have a 6:30 standing meeting. So it might be that, not second Tuesday, sorry, second Monday of the month, I have a standing town board meeting. So sometimes this comes really close up against that anyway. So we might want to consider a different date.
Sounds good. Thank you.
Mm-hmm. Like even instead of second Monday, we could look at first Monday. But I would just ask Julie or team what works best for them.
That would cause issues with the financials.
Oh, okay. Yeah, you could check with your team and see what might make sense. And certainly the board members, we could look at a different time that is, I think ideally if it was 5 or 5:30, does that make sense? Either right at, if it's staff who want to participate, it might be more convenient. The closure time is 5 o'clock, right, for public health?
Well, yeah, for a lot.
For most of it, the front, okay.
Great. Thank you.
Thank you for that. And let the minutes know, can you repeat the 2 names who gave that input?
Ms. Jennifer Enoch and Mr. Jim Barrett.
Okay, Jim Barrett and Jennifer Enoch. Okay. Any other correspondence? Okay. I just, one piece of correspondence is I know that it's tick season, and I noticed that Public Health had put out a note about Rocky Mountain spotted fever, and I'm really glad that we are looking at that. I did have a question that came to me when I reposted whether or not they can bring their ticks to Public Health, or if they should bring them to their doctors, or what they should do.
Don't take them to the doctor. I don't think they should take them to the doctors. They can bring them here.
They can bring a tick
Yeah.
here to get tested.
I mean,
We
we won't test them, but we'll
No.
get them to where they take them to iTech.
So you can actually take photos and upload them, or I think they can bring them.
You can
here.
identify, we have cards that you can identify them with, but, I mean, we don't.
Yeah, there's a place in Rhode Island that will identify ticks for you and provide you with lots of interesting information, species, how long it's been feeding, diseases that it carries. And then there's a local program as well that will identify ticks for you. And I can share more information with you after the meeting.
Okay. I did check since I was at Convenient Care. I asked them if you could bring ticks, and they said, at least at Christie Convenient Care, that they liked that when people brought the tick in with them, and that they could send it for testing. So it might be useful to see if Christie and Carl, I mean, that was Convenient Care, Christie and Urbana. Who knows if the right hand is talking to the left, but if there are other help.
Usually doctors don't want, I'm surprised, they don't want that in there. They absolutely want to know that you were bit by a tick or that you had
Yeah.
a tick on you, but a picture would be sufficient.
Okay. Yeah, so
Um,
if there's other information, I believe they were gonna be
Would-
hearing a lot from people on this issue.
Yeah. Oh, there's a
'Cause
ton of ticks
they're,
out right
you
now.
know, we, like, go to Meadowbrook and come home and there's 5 ticks on you, so
Mm.
that has not been the case in the past, so I just wanted to share that that might be
And
an
did you
issue
see
where,
that Illinois has a new tick as well?
yes, the Asian
Longhorn.
longhorn, yep. I knew I'd become a tick expert, okay. That's all, thank you for that, I appreciate it, but I think some of the board members and staff will be hearing from folks on that. Any old business? If not, new business, we have a treasurer's report, Ron?
Yeah, we've got the March 2024 financial statements. We're showing cash on hand at $6,814. Total fund balance at $7,815,370. That's representing 42% of our budget expenditures for the year. That's falling within our guideline of 20 to 50% of annual expenditures available in cash. We ended the 9th fiscal month with the deficit of just over $1 million. Our annual budget is $8.4 million with the operating deficit budget of $2.78 million. Revenue for the first 9 months, we were at $11,656,519. That's $75,093 under the year-to-date budget. Property taxes were over year-to-date budget by $26,000. Grants and contracts under year-to-date budget by $158,000. Fee for services were under year-to-date budget by $88,000. Other revenue was over year-to-date budget by $146,000 almost. Total expenditures were at $12,690,000, which is almost $1.2 million under the year-to-date budget. Personnel was under budget by $396,000. Fringe benefits were over the year-to-date budget by $51,894. Contractual over year-to-date budget by $138,000. Patient care under year-to-date budget by $165,000. Supplies under year-to-date budget by $287,000. Capital outlay under budget by $244,000.
Thank you. I just had a question, is personnel, are we basically staffed up at this point and the under budget is from the earlier part of the fiscal year? Or do we have vacancies?
We have some vacancies, but, they're on the budget. I mean, we have, I don't know, I think we're trying to, the big one we're trying to replace right now is the dentist, but we have several vacancies, but it's all factored in there.
Other questions? Next we have approval of payments to the Board of Health appointees. I'm gonna take these in an omnibus fashion. Treasurer Ron Fields for April 2024 services, Attorney Ruth Wyman for legal services, March 16th to April 15th, Attorney Ruth Wyman for legal services, February 16th to March 15th, Administrator Julie Pride for the IAPHA meeting and public health transformation training in Springfield. So moved.
Second, Carter.
Any discussion? All those in favor say aye. That carries. Next, we have the review of the monthly credit card statements. Do you have any questions? I didn't see any questions. We'll just put that on file. Next, we have designation of the designation of the budget document for fiscal year 25 tentative budget and appropriation ordinance 2024-06-01.
So moved, Carter.
Second, any discussion? Is there anything that we wanted, I know we're putting it on file and it'll be on file for 30 days for public input and then we will approve, but was there anything that the staff would like to share, about the budget this year?
I don't think there's anything that's different in the budget except for no COVID money, but it's been 2 years. Was there anything, Sean?
No, nothing that really stands out.
All right, we have a motion and a second, all those in favor? Aye. Those opposed? That carries. Next, we have approval to revisions of the public health administrator job description. It's gonna be followed by approval of revisions to deputy administrator job description. They seem to go together, so feel free to talk about both.
Okay, well, we're just like updating them, the administrator job description hadn't been updated since I think before me. And it's before we had a deputy administrator position, and we never really reconciled those too well, so that is, so when Oase became deputy administrator, he was also director of planning and research, and we sort of merged those two jobs together, which was not ideal. So we kind of teased those out. Candy was on that. Who would you working on with that, Candy?
Whitney.
Whitney.
Yeah,
Oh, well, you're both in there, so. Is there anything in particular that you want to bring out about, it's,
Just updated 3.0 stuff.
yeah, it's all moving towards public health 3.0, but if you look at it, it's kind of like the administrator is the CEO and the deputy administrator is the COO. And we're trying to do it in such a way that that's succession planning.
And we currently do not have a deputy administrator.
Correct, we have not since Oase.
So this would be your job description, the public health, and then basically we're submitting a deputy administrator
Yeah,
position.
and the administrator job description is adjusted for the deputy, which we never really did, even when we have one, so.
Okay.
Anything else in there you guys can think of that pops out? No.
We want to get a motion on the table that we can have discussion. I would take both in omnibus fashion to approve of job descriptions.
So moved. Art.
Second, any discussion? I just had a quick, thank you for this. I looked them over and I see exactly what I saw it as a COO and a CEO. One question I had is the administrators, maybe I'm reading this wrong, but it seems that the administrator has less experience requirement than the deputy. So in the deputy, it said graduation from an accredited university with a master's degree in public health or a related field and 5 years. Whereas this one's, if I look at the administrator, it's master's degree and 5 years, oh, I'm sorry, I'm reading it now, and 5 years or a graduate degree in a related field and 5 years. So basically it's almost the same, it's just that you have to have the ability to become a certified public health administrator within 18 months.
Yeah.
I misread it, I'm sorry, I didn't see the first 5
Yeah,
years.
and anyone who, for example, like all the directors of CUPHD could become public health administrators if they wanted to, even though they're not public health administrators.
Mhm.
So that, having been through that process, it basically is just a way of showing that you can do various things, or that, not that you can do, that you have done,
Yeah.
and which, the way we have directors around here, they've all done basically the stuff. It's a huge time commitment.
Mhm.
But other than that, I mean, we would need somebody in there who could do that, and it's for accreditation, so
Okay.
that was the main reason why we,
So basically the idea is that the deputy at some point would be working on the certification, but it's not a requirement coming in.
correct,
Okay.
yeah.
That is good. Any other questions or comments? Okay, we have a motion and a second. What? Go
I'm
ahead.
sorry, and just the idea too with the 18 months, I think, is that within the year, if somebody is hired that doesn't have it, within the year, they'll be working to get that.
Okay.
That's awesome.
All right, I'll take the vote. All those in favor say aye.
Aye.
Those opposed, that carries. That was an aye, I didn't say. Okay, both of those are moved omnibus fashion. We'll move on to approval of proposal for Davis Electric for data lines for the Great Start remodel project.
So moved. Art.
Second, hold on, I had a.
Sometimes I miss that tiny Neal Street office.
Oh, okay. We can hang out all day, the board meeting is canceled. guess I am trying to get to, we're in the middle of the budget. I'm trying to get to the page that is, I think it's 192, ridiculous electric. Did we basically go through the process of bidding it? Oh, you only received one bid.
Well, what we did was, Dave's Electric is doing the electrical input now. They got that portion of the bid through subcontracting. Since they've already got all the conduit, they got everything in, and there's an oversight that the data was not put in, so that was just
Got
added.
it. This is like almost a change order on an existing
Correct.
project that they're already working on.
Right.
Cool, that was my primary question.
Apparently they thought they needed internet in there.
All right, we have a motion and a second. All those in favor say aye.
Aye.
Those opposed, that carries. Approval of bid from Rowline Commercial Painting for MCH Office Painting. I move approval. Do you have a second?
Second, Carter.
So we have a motion and a second. Let's see. Yeah, so I just want to note that this is a local business and union workers, it's minority owned.
Local minority owned, do quite a bit with
What's that?
Local minority owned, do quite a bit with us.
Mhm. Great. Any questions? All those in favor say aye.
Aye.
Aye, and those opposed, that carries. This is helpful because I'm jumping between two documents, thank you. Approval of contract between CUPHD and La Familia Health MFP, not-for-profit, for transgender and gender diverse TGB wellness and equity program.
So moved, Carter.
Second, any discussion? All those in favor? Aye.
Aye.
Those opposed? That carries. Wait till DeSantis starts firebombing our social media over that.
Right, right.
Okay, next, approval, I'm from Florida, and
Yeah.
glad I don't live there anymore.
Exactly.
Approval, what's that?
That's an exact.
Yes, it's beautiful.
It's fine as long as you don't need to read.
Yeah, or get pregnant,
Or
or,
get pregnant.
you know, identify as trans or be queer in any way.
Right.
Okay,
And these programs are definitely needed in our community, so I'm
Yes.
thankful for this.
very much so. Actually, I mean, like most of this agenda is good news for our
Yeah.
community. It's really nice to read. So, I appreciate public health. Approval of sub-award between CUPHD and the Board of Trustees of the University of Illinois for developing community-based research engagement and capacity to prevent adverse birth outcomes for perinatal 5POC members of the public.
So moved, Carter.
Second, any discussion? I just want to say I'm really happy that we continue to lean in on this. I'm really happy that we have a doula on, you know, that been hiring for a doula.
I think
And-
3. Don't we have 3 currently? 2.
Too. That's great. I'm referring people here. And we're also looking at this piece, because so often when we look at statistics, we don't look at them broken out by race and sometimes gender, and it reveals a totally different story when you do that.
No, it absolutely does. In fact, Monica McLemore was just here, and she showed an example of how, you know, maternal and infant health, how it looks like it's improving slightly, and got worse, and it's improving slightly, and then you break it down, and the African-American numbers are hideous, so.
Yeah, so it oftentimes is hidden,
It
it's
is
some of
hidden.
the.
You have to
some of
break
the-
stuff down.
Yep.
And that's, and just so you know, part of Public Health 3.0 is to get down to the granular level of data, which is, it's harder, but it takes more time. But the idea is that health departments stop doing some things and start doing more of that, to get that information out there, because it is constantly hidden. Just out of, sometimes I think out of sheer laziness, and sometimes intentional.
Yep.
Not by us, but I mean, in general, you just don't do it. And I do think some of it's laziness.
Well, if you don't live it, you don't see it. We have a motion and a second, all those in favor?
Aye.
Opposed, that carries. Next, we have approval of requisition payable to Surface 51 for the 2024 media campaign for National HIV Testing Day.
So moved, Carter.
Second, any discussion? All those in favor? Aye. Those opposed, that carries. Next is approval of Dell laptops.
So moved. Carter?
Second, any discussion? All those in favor? Aye. Opposed, that carries. Next, we have approval of check request payable to Sikich for final billing of the fiscal year 23 audit.
So moved. Carter?
Second, any discussion? All those in favor?
Aye.
Opposed, that carries. Next, we have ratification of check request payable to Straight Up Solar.
Oh, so moved. Carter?
Second, any discussion? I just we will discuss some of this issue in closed session.
Yep, the next three items.
But these are 3 checks ratified, due to, security breach that we experienced. Any other discussion? All those in favor? Aye. Opposed, that carries. Next, we have ratification of check request payable to A&R Mechanical Contractor, Inc.
So moved. Carter?
Second, discussion. All those in favor say aye. Aye. Opposed, that carries. Next, we have ratification of check request payable to Tyler Technologies.
So moved. Carter?
Second, any discussion? All those in favor say aye. Aye. Opposed, that carries. Approval of check request payable to Zobrio for Financial Edge annual subscription.
So moved. Carter?
Second, any discussion? All those in favor say aye.
Aye.
Opposed, that carries. Next, we have approval of bilingual pay stipend policy.
So moved. Carter?
Second, quick question, I know we talked about a bilingual pay stipend policy during the union contract negotiations. Is there any, can you explain any differences?
Well, we already had one. We already had a bilingual policy, and this, basically what is going to happen is, before we had it for pretty much everyone. Now it has to be, we're going to do Spanish and French, because those are the ones that are needed. And we are going to, it has to be, there's just some more language in there. Basically, if you are getting the stipend, which is a $3 an hour stipend, which is pretty large, you need to actually translate when we ask you to translate, and things like that. Is there anything? Oh, yeah, and there was testing, so that there would be no, this was just
Testing to see.
testing to make sure that they,
Yep.
qualified as,
And it is written translation as well as spoken, right, that we're requesting?
I believe so, yes.
Okay, because the written translation is very expensive and it's quite good for us to take that in-house, but people will, it's a certain skill.
Yeah.
So testing on that skill makes sense. I'm sorry.
Is
did
there
I
anything
do-
else you guys can think of that is in that policy that's different? That's it?
I just wanted to mention that we use Proprio service, which is it's an on-demand service for any language, including ASL, at Township, and we are just really super impressed by it. So in addition to having on-site, we also have Spanish and French speakers on site, and I very much support having on-site folks who are multilingual. But if you have somebody who comes in who speaks Farsi, or someone who speaks Ball, or somebody who speaks there are so many languages that we may not have on site. So I don't know if we have a system.
We
Do we
do.
use a
Yeah.
tool? Okay.
Yeah, we have I don't think it's that one.
They changed names too.
Yeah, I know, we've had one for years and years, but I don't know what it is called now, but yeah, it's still being used.
Yeah, I just shared that we had it and only a few people used it, so we did all staff training with it. And everyone was like, oh, this is so much easier than I thought. And I said, I want you to have a phone call. Everyone should use it in the next 2 months. Just use it to get over the hump. And so so they did that and they've been reporting back. So it's really helpful to kind of encourage people instead of taking a message and, it's to speak people's language on site.
Very important to be able to communicate.
Exactly.
Mm-hmm.
Yep.
So, do you have any questions about this? Okay, comments. Okay, we have a motion and a second, if there's no further discussion, all those in favor say aye.
Aye.
Aye, opposed, that carries. Next, we have pending grant, contracts for the administrator to sign. Do we have any, okay. Before we go into closed session, there was a request for us to have a second public input participation. So if we could go ahead and have a second public input session, I saw that there are additional people who joined us today. Feel free if you would like to step up to the podium, state your name and share whatever you'd like to with the Board of Health.
Hi, my name is Jennifer Enoch. I'm a nurse practitioner here. And I wanted to talk about some things that have been going on here that we've been asking for some assistance for. I'm going to read you a few things. We gave these anonymous testimonials to management during our union bargaining session. Some of the people made formal complaints about these things, but most didn't feel comfortable using their names, so all of these are anonymous. Each page is from a different person. So these are the things that people are saying that they've had trouble with. Getting mistaken for or mixed up with other Black coworkers consistently. Being asked impromptu opinions about race-related topics. A Black client with small children had been asking for help with a food referral for 3 weeks. The call got transferred to me the next time that she called. The client was distressed and anxious to get food for her children. She did not have transportation to get to food pantries. A white supervisor admitted that she had dropped the ball for 3 weeks, stating it was because she was so busy, even though she was just sitting and gossiping with a work friend at the time that we discussed it. I helped the client to get 2 food bags delivered that day and a food referral from Empty Tomb on the next Monday when it became available. When I let the supervisor know that the client was getting food, the supervisor told me that she would not like the food because she wants what she wants, and then criticized the client, saying she should ask her baby daddy for help. Using the phrase baby daddy repeatedly, the supervisor stated that the father of the client's children was a former CUPHD janitor who was known to her and who has children with several women. She implied that the client didn't deserve help because of this, even though if he does have children with several women, that doesn't mean he has enough money to make sure that they all have food. And what if she had asked him for help and he had said no? Or what if she didn't want to ask him or did not feel safe asking him? Maybe she didn't want to know that maybe she didn't want him to know that she didn't have food. The supervisor just did not care about the hardship that was put on this mom and did not care about the children. Who don't want what you want? You want food for your kids and security. It's embarrassing to have to ask for help in the first place, especially repeatedly. And then to be treated like you're nothing and ignored for 3 weeks. Food for her babies was her main concern, was what I got from our conversation. CUPHD employees make food referrals frequently, and white clients are treated better. For days, my stomach was in knots, and I could not rest thinking about what the supervisor had said and about the way that my daughter or my niece and other people who look like me can be treated this way by public health, which is paid for with tax dollars and should serve people equally. I had trouble sleeping, and I was beside myself, just remembering over and over the way that the supervisor had talked about the client. It replayed in my mind even though I didn't want to think about it. My stomach was in knots until I did something about it. I tried to discuss the situation with our division director and Julie Pride, but they were away on vacation. I spoke with the DEI specialist because I feel that this is an issue of racial bias. She said that she would look into the situation, but later told me that the division director and Julie informed her that the supervisor is not racist and that it isn't the DEI specialist's job to look into situations of racial bias, and that I violated the chain of command and client confidentiality by bringing it to her. But no one ever talked to me about it, not my supervisor or division director or anyone. I wake up each day and I pray to be fair to each and every person that I encounter and to help their family needs be met. There was a job opening that we desperately needed to fill. The hiring manager let me know that someone had expressed interest and then said, "But she's too old, so I'm not even going to consider her." I let her know that this is illegal. She clarified, "I don't mean I'm not considering her because of her age. It's because I assume she's too old to be able to learn how to use the computer." I explained that this too is illegal and urged her to give fair consideration. But I think unfortunately I just taught her to use a pretext instead of to voice her true reason. Having been a part of CUPHD since 2018, I have personally encountered instances of discrimination and racism within the workplace. One particular incident stands out in my memory, involving 2 employees of color who applied for a coordinator position within the program they were already working in. Both individuals possessed the necessary experience, education, and qualifications for the role. However, while one of them received an interview, the other was not even considered. Surprisingly, the interview process included a dental hygienist with no relevant experience or education in the field. Unfortunately, neither of the qualified employees were ultimately selected for the position. Instead, HR and management opted for a white candidate who had identical experience and education levels. I was asked to help to make some copies. The supervisor who asked for my help said to me, "Don't worry, this is very easy to do. You don't have to think or talk to anybody." I don't think this is a decent or correct way to ask for help. And besides, I always think, and I like talking to people. I found that comment very offensive. I experienced racial discrimination at work. I have also noticed that happened to others. The work that each employee is assigned to do should be valued. There should be equal opportunity for employee advancement, but there is not. A safe and stable environment would be the one where coworkers get along together, not because they look alike or think alike or talk alike, but because they share a goal of caring for the community. I know people who told me that they quit working here specifically because their immediate supervisor was racist. It's clear in the way that some people speak to and about Black coworkers. It is common in our workplace for people to dismiss and demean the knowledge held by Black employees. Changes in procedures are communicated better to white employees and others are left out of the loop. If I need to know what has changed, I wait until I can ask a specific white coworker because she doesn't treat me like I am stupid. If I ask the others, they act like I am stupid and bad at my job, and I would rather make a mistake and get in trouble than deal with that. When, name redacted, the nurse supervisor left, most of her work was taken over by a Black employee, but they wouldn't give her the promotion or a raise for the additional work she was doing. A white coworker was allowed to treat her disrespectfully and cuss her out. There is a double standard in the behavior that is considered acceptable. A coordinator says derogatory and inappropriate comments about clients, like calling them trashy and poor. We serve low-income families, and it is inappropriate to be discussing clients that way. This has made it a negative work environment. Many of us dread coming to work and do not have a positive attitude. The all-white leadership is a problem. The lack of perspective affects how resources are allocated. There is talk about equity all the time, but the most pressing needs in the community always get relegated to the back burner and the lowest priority. One of our coworkers was working remotely one day while she was home with her family in Asia. The rest of us were working in person. A supervisor laughed about this and said we were outsourcing our work like Verizon outsources customer service. This is an unacceptable comment, especially from someone who had to complete cultural competency classes for their degree. We serve diverse populations and we should respect other cultures. So we shared these with management's bargaining team on October 30th. Several of us have written formal complaints about the same, well, some of the issues included in here and some different ones. I'm gonna share with you the one that I wrote and the anonymous testimonials that we have shared, and also a conversation that happened on email after the Equity Council was dissolved.
So these are for board members, you should be up to them, you would have this.
Oh, I have more.
Okay.
What was this?
Where's that? Ms. Ruby couldn't be here tonight because of a prior engagement, but she would like me to share with you that you can feel racism in the air here, and Black people often are made to feel like they aren't really welcome, and that this isn't going to change until people's thought process changes. They can fix it, but they don't want to. So Ms. Ruby and I feel like we have done our part. The outcome is not in our hands. We think the outcome is in your hands. We are asking for outside assistance, like the CU Trauma and Resilience Initiative that CUPHD has partnered with in the past. And also speaking as a union steward for many of my coworkers, we're asking for you not to approve the expense of getting a time clock surveillance program. We do our work, we do it well, and people are concerned that this surveillance program has GPS location in it and seems intrusive and maybe like spyware. Thank you for listening to me.
Yes, a couple of questions.
Go ahead.
I was typing because I was trying to take notes on what you said. So, first I just wanted to share that we talked about moving these meetings at the beginning. Ms. Carter brought up the request to move the meetings, so we will need to vote on moving the meetings to a more appropriate time for working people, including CUPHD staff. I think there's interest in us doing that. And so we'll be looking at a time at the next meeting. We would vote on it at that meeting, and then it would go into effect. So I know that you were one of the folks who brought that forward, so thank you for raising that concern with us. And it's something we've gone around and around a bit. This is not the first time it's been brought up. I think it's a problem if we want to be open to the public. And then I had two questions. One is, I just want to make sure I understood your ask. You want outside assistance from an organization like CU Tribe, and there's well, you had three asks. One was change the time, so I wanted to address that one. Second was outside assistance, and third was expense time clock surveillance program. So on the second one, is it, I work really closely with CU Tribe, and I got that they did some work with CU Public Health. Can you share with me what work you're aware of that has been done?
Yeah,
And
really great.
what your request is, like if you're more specific around the request, like are we asking for an organizational assessment or review or a racial equity review, or we've done both with at Township with Karen Sims and CU Tribe. I would just, if there were more details about what you were looking for, that would be helpful.
Yes. We had a really wonderful education session with Karen Sims. It was like before the pandemic, but what we're asking for is a racial equity analysis and help in creating racial equity here with them or some other outside organization.
And then just, I can also ask supervision this later, but just from your perspective, the time clocks, my understanding is that most punch clocks that are now virtual have a tracking mechanism in them. And so you're saying that this is new to public health and you don't want its implementation?
Yes.
Okay. Okay, that's all.
Thank you.
Thank you. Is there anyone else who would like to speak to the Public Health Board this evening?
Hi, good evening. My name is Tamika and I'm an intake specialist here at CUPHD. And I enjoy working here. I really don't have many bad things to say, I guess. I am in a group of, the Justice Coalition, and we did have a program that we put on earlier this year. It was February 22nd, and it was from 6 to 7:30. And the people in the group volunteered to be here. We wanted to be here. We wanted to get our group out, let everybody know what's going on. We had a good time. I guess my only concern was we didn't get paid for the event, which I personally didn't matter because I wanted to be in this group. I've given my time to this group. But, excuse me, other groups, like if you were in Pride or if you were in any other service here, they got paid to be there. They got paid to volunteer. They got paid to help out in the program. This is the first one. I've known other events and gotten paid for them as well, like either flex time or other time. But this is one of the events where I didn't get paid, or any of my other coworkers. It was just up in the air on why we weren't getting paid. It was like, oh, this is a new group, we'll figure it out. You know, this is what I was getting told by management. So I wasn't understanding why specifically this group wasn't getting any, getting paid for their services, as in the other groups that get paid for their services. So I didn't know if that was just gonna be somewhere clear across something, or I didn't know. So I just wanted to come to work and ask, like, or put it out there so somebody could find out why, or.
Okay, can I ask you a question?
Sure.
So, what was your role? I remember the event. What was your role, and was anyone paid for that event? Or is the issue that nobody was involved was paid? So those are two questions.
Sure, yep, my understanding is no one was paid for the event. My role in the event was to help out. We set up, we did have, it is a little weird, like when you're in the building, you understand, we had a lot of people coming to the front door, so I was out there letting them come through the front door and bringing them back here because we have the secure doors.
Mm-hmm.
So yeah, I was bringing a lot of people from the front to our meeting and stuff. So yeah, just helping out wherever I could. We did have like snacks and stuff, but either way, I wanted to be there. I wanted to help out, but I just didn't understand, like, if I worked another event, I got paid for that event. But this event, it was like, no, because my understanding was because it was a newer club or group, that they were still looking into it. So.
Do you remember about how many staff are involved?
We have about 6 to 7 people, I believe. It might be 8. But
Okay.
Yep.
Okay.
In the day and time of this event?
It was February 22nd, and the event started at 6. It was from 6 to 7:30. Got here a little early, just left a little bit later than that, but yeah.
Evening?
Yes, ma'am. Yep, 6 to 7:30 evening, yep. Yeah, like we said, well, the board kind of went on, well, not the board, the panel kind of went on, everybody was speaking as well, so we probably left about 8.
Okay.
Yeah.
And did anyone come back and did you discuss it with your supervisor afterwards? It sounded like it was unclear whether people would get paid. They're like, we're not sure. Was there follow-up by you or your supervisor around that?
When I spoke to my supervisor, she told me that the director said they were doing a great job. They enjoyed the meeting. A lot of the directors came, well, one of the directors came and they enjoyed the meeting. They like what we're doing. But as of right now, that program, it was pretty much like, you guys are doing a good job, but it's more on a volunteer basis. So.
Did you have any other questions?
Okay, thank you.
Thank you.
Anyone else who'd like to speak to the public health board, feel free to come to the podium.
Hello, my name is Devontae Harris. I'm one of the newer case managers in TAS. I've worked a number of jobs all across campus, in town, whatever the case may be. But coming here, for one, I started as a client, coming for services and everything. But now being on the behind the scenes, if you will, I kind of have felt the uneasiness sometimes, just trying to talk to coworkers, other people in the building. Like I can remember somebody of color gave me a tour of the building besides like our departments or the usual training. And one of the things that was said to me was, you know, you have to watch your background here, the things that you say or do just because of the color that we are. So, you know, me being me, somebody that's gay, black, first generation, things of that nature, overcoming barriers across the board, it was one of the most unsettling things because working at a public health district, you would think we will accept and talk to people of all different types of colors or whatever the case may be. And after a couple of weeks of working here, I started to realize those things. So me being me, I'm a lovely person. I come in and speak to you good morning, whatever you say it back to me, I have no issues. But also, if I come to you for help being somebody that's new, I would expect for you to help me do my job. However, it was times where it was looked at, I should already know what I'm supposed to be doing. So because of that expectation, I was never properly shown or trained how to do those things. So a lot of things I had to overcome and learn on my own. Another situation, I've heard how, I can't necessarily say the department at this time, but there was an event going on and one of the supervisors came in and snapped at one of our maintenance people. Come here act like he was a dog or anything. We shouldn't treat people like that. It should always be a level of respect across the board, no matter what your role or division is in the department. Also, there has been unfair treatment as far as it's kind of was when the union was getting established, but there was a lot of mix-up with policies. So there was a situation where somebody else of color followed all of the protocols as far as calling off, even went above and beyond to provide proof in the moment, whether it happened before a shift, during a shift, whatever the case may be. But I personally witnessed how this person, supervisor, talked to them. This mother, single mother, came in on her off day to do her TB testing. Her PTO was already approved, so of course she has the day off. With her sick child doing her TB test, so a supervisor comes across the building. He says, "Oh, so you're not working today?" She says, "No, it's not. It's on my calendar. I've already talked to you. You approved my PTO." "Well, you're just not going to work today at all, are you?" "No, clearly I'm not. I'm here with my sick child. I'm doing my testing, which is required for employment here." So you care about your child more than you care about this job. That's a red flag right there. Of course, she's just going to take care of her child more than her job. But if it was anybody else, from what I've heard in the past, there has been something worked out where even if somebody couldn't take off from the job, they were allowed to possibly bring up their child to work with them for the day, or they gave them, assigned them work to work from home, still making sure, everything was being taken care of. And in this situation, it wasn't given that. But also the fact that HR and the supervisor for me told her verbatim that her child is more important than the job was out of line. I can go on and on, honestly, but generally, either way it goes, it is a sense of racism in the building, which is something that is unsettling. Some people don't even want to work here. Like, just the fact that I keep hearing a turnover of people of color within the past 2 months is insane to me. And then just hearing about hiring somebody else that had the same credentials as the people that already worked here, I assume that we're supposed to be hiring from within, especially somebody that's been here over time. So to then hire out somebody that has the same credentials, I feel like isn't fair. So I don't know exactly what all can be done, what needs to be done, but I do say there needs to be some type of change done in order for people to feel just welcome working here. Nobody should have the idea of, "Ooh, I don't know how things are going to go in today, I'm just going to call off." It should be, I don't know, it's a public health district. Like, just walking in, like, with our intake office, which is something that I see different from any other department. We smile, we talk to you, we have a conversation, treat you like a regular person. And anybody else is like, "Okay, you're just another person, roll by, let me move you on out of the way." Even behind the scenes, I have definitely heard conversations with employees talking about the clients that we have. Like, it was said earlier, she's trashy, or she has this type of background, so they don't deserve this and that. That shouldn't indicate everybody should deserve the same type of care. It's the health district, everybody has health issues, regardless of where they're coming from. And now that we have refugees also, that has been another conversation that really needs to be touched on. Because, at least for like in TAS, we're not talking about their sexual history. We're supposed to be doing SCI testing. We have to talk about these things, but that's stuff that isn't being put in place. So again, something needs to be done. I don't know what can be done, but please and thank you ASAP.
Can I ask you one question?
Yes, ma'am.
Thank you for your input. Just on the last topic, are you, just so I understand, are you saying that you need to speak to people about sexual testing, but there may be, certain populations where you feel like you want more training on how to approach those populations? Is that what your request? I was just trying to understand. You said there isn't something put in place. Can you describe what that thing is that?
So
needs
with
to be put in
that, I
place?
guess that would be more, extra procedure steps add in. Because how can you properly test or treat somebody for TB if you don't even know if they had this type of situation in the past before they came over? Of course, they're gonna have different type of healthcare depending on where they're coming from. But it's not an extra effort to get the full story. It's more just generalized and then you get passed on. Versus, okay, if I know you got treated for syphilis where you're from, and you have an issue when you come over, I'm not just gonna automatically assume, okay, this is gonna be a syphilis case. You have to go through the whole proper steps, okay? When were you last tested? What treatment did you get? Do you even remember treatment? Because a situation I can remember, a client was told they got treated for something that they didn't even think that they had, but now it's an issue now. So it's like, conflict. It just needs to be clarity altogether.
Around the procedures within the department. I see. Thank you.
Any other questions from this concern?
I'm just so sad to hear all this, because serving this community, I know, is a lot. You have so many responsibilities that are just taken over, and it's gonna take a team effort. And everyone in the work environment should feel welcome.
Ooh, one more thing I want to add, I'm sorry, and this just happened recently. So the PMC, something that CUPHD has made on their own, got awards. But we now have to make a video to explain the whole process and everything, right? So we're in our meeting and it's being asked, okay, we would like to do the video. And of course, at this time, I'm the only person of color. Everybody's, no, I don't want to do it, I don't want to do it. But clearly, I have no issues with being out on the forefront. So I said, of course, I'll do it, happily, no problem. But then it got added on to, yeah, it looks better if you did it because you said the quota. I said, well, what is the quota of who's supposed to be coming to do SEI testing? So, somebody of color, somebody that has sex with other males and other things like that. But it shouldn't even be like that. Everybody has sex, everybody can have SEI, so what makes me fit the quota more than anybody else? I feel like that was a comment that shouldn't be said, because again, I would have did it willingly, but the fact that now I feel like I'm being targeted or have to fill a certain quota, I don't think it's right.
Thank you for your testimony.
Appreciate you, thank you.
Anyone else who would like to speak to the public health board? Going once? Going twice? Okay. Let's see, next, what we have is closed session, I have strict orders. Speaker, okay. We are, a motion to go into closed session to discuss pending litigation affecting CUPHD pursuant to section 2C11 of the Open Meetings Act, ILCS 120/2C11. And I'll read from chapter and verse 29, C29.
I think it's just 11.
11, sorry, wrong page, 11. Litigation, when an action against, affecting, or on behalf of the particular public body has been filed and is pending before a court or administrative tribunal, or when the public body finds that an action is probable or imminent, in which case the basis for the finding will be recorded and entered into the minutes of the closed meeting. I will make that motion.
Second.
We have a motion and a second. Any discussion? All those in favor say aye.
Aye.
Opposed? He's not here. That carries, and we will go into closed session. And I believe for this closed